Hi, everyone, and welcome to the Truth and Fertility podcast. Today, I have a really exciting interview for you. I will interview a woman named Lori Gonzales. She is a natural family planning instructor, primarily for the Catholic Diocese of Phoenix in Arizona. And she usually teaches engaged couples natural family planning. She does a lot with couples that are preparing for marriage. Now, today, I chat with her about breast cancer and its link to abortion and the birth control pill. She knows a lot about this topic because her own father actually was an OBGYN. And as she will mention in our interview, he was really a renegade in this topic of not wanting to prescribe the birth control pill and wanting some sort of alternative and better medicine for his clients. And so he came across a lot of this information way back when, and now she is kind of taking the baton and taking his information and continuing to spread it and to make these links known. And we have a really good conversation about just the link again with breast cancer and abortion and the pill. She does a really good job of outlining everything in a very simple and understandable way. So stick around to hear more about the link between breast cancer, abortion, and the pill. And I hope you enjoy the interview today. Welcome to the Truth and Fertility podcast. My name is Haley and I am your host. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either achieve or avoid pregnancy and also to manage their fertility. I have a huge passion to teach women and couples about the beauty of their fertility and how the pill is never the answer to women's health. There's a lot of good and not so good information out there about fertility. And so my goal with this podcast is to help you sort out the truth from the weeds. I want to teach you how to chart your cycle and to reach your family planning goals while also maybe even possibly locating hormonal imbalances and to receive proper treatment. I want to help you get in the best hands that you can with the best doctors that you can to reach optimal reproductive health. So if you're ready to get on this journey with me to learn more about your reproductive system, how it was created and how it should be working, and the best medicine in order to make it work if it's not, then you are in the right place. Hi, everyone, and welcome to the Truth and Fertility podcast. Today, I have on Lori Gonzales. She is a longtime friend of mine, also a natural family planning instructor, and she knows a lot about how breast cancer is linked to the pill and also abortion. So that is the topic that we are going to be diving into today. So before I really get in with my questions and everything, Lori, if you could just introduce yourself, tell us how you know all this information and anything else you'd like to share.
Well, thank you, Haley. You're very generous to invite me, and I'm excited to be here. I have been a Sympto-Thermal instructor for 15 years. I'm also the daughter of an OBGYN, so I kind of grew up surrounded by, all that terminology and facts. And my dad, I would consider him to be sort of a renegade OBGYN. He started practicing in the early 70s, but he did not get on the contraceptive train. He really early on felt like this was not good for women and spent, a great part of his practice just trying to help women live within the truth of their bodies without, resorting to artificial contraception. So, so the way I came about this particular topic is my dad, again, always being interested in this topic, came across a book several years ago by Kahlenborn, and it's called Birth Control. It's linked to abortion and the birth control pill. And in reading this book, he realized that this information was not getting out to women. It was not even really getting out to physicians. And so he created a PowerPoint presentation and just started giving it to anyone that would listen to him. And I think he actually, I was going back through his stuff, and I think his first presentation was sometime maybe 2015, 2016.
Okay. How old is the book? Do you know?
The book,
off the top of your head?
That is a really good question. 2000. Yeah.
So the book was written in 2000.
The book was written in 2000.
He found it, started giving presentations on it in about 2015. Okay.
Yeah. So basically, this book is considered a meta-analysis. So he didn't do his own research, but he literally just scoured any kind of research that had been done on birth control in the years leading up to this and just put it all together. And nobody had really done anything like that. So my dad, gave these presentations and did a great job. And, I think it was just within the last maybe year and a half or so that he was asked. I think it was the first time that he really felt like, it was a little too much for him. He's 80 years old and obviously trying to slow down, be retired and relax. And
pass the baton.
He didn't actually ask me, but I just kind of was sitting on my heart, and I kept thinking, this information doesn't need to be just sitting on his computer going away. And so I brought it up to him, would he like to hand it over to me, help me to absorb it and answer my questions. And I told him I'd be willing to pass it on. Yeah. So that's kind of how I got here.
Awesome. And I heard your talk about a year ago now, and it was incredible how complex yet simple it truly is. It's complex but easy to follow, I should say. Right. So I'm really excited to dive into that. So first of all, can you just kind of walk us through what is breast cancer? Like when we say breast cancer, like what does that even mean?
So cancer in general, you could kind of consider it just good cells gone bad. So, all of our cells are multiplying, reproducing through mitosis. And so as that happens in our bodies, sometimes those copies are not made perfectly and mutations occur. And so anytime that happens, if you have a mutation, so you have a cell that's not perfectly replicating, and so something goes a little bit wrong, well, then that cell also replicates, and then something might go a little bit more wrong. And so they say it takes about 6 mutations for an actual cancer cell to develop, but that can happen anywhere in your body. Right. So breast cancer is just, that happening inside the breast tissue. So yeah. Okay.
So then before then going in deep diving into the pill and an abortion and how those are linked, can you talk a little bit about the anatomy of the breast? Because I know that a lot of that information really relies on what the anatomy even is and those cells and all that.
Yeah. So obviously we're all familiar with the exterior of the breast, the areola, the nipple, but inside, I think the best way, and again, I got this from my father, the best way to get a mental picture of the interior of the breast is to picture a bunch of grapes. Yeah. And so if you were to go to the store and you pick the largest portion of the stem and you lift it up, it's obvious that stem then segments into several other smaller stems and keeps doing that. And then eventually you have the grape at the end. And the breast is very similar. It has ducts, and those ducts branch off and get smaller, and then eventually you have the lobes, similar to the grape, and a lobule actually. A lobule will be compared to the grape. So a lobule is basically a duct and the surrounding mammary glands. And so if you get several lobules together, then we're going to call that a lobe. Okay. And so that's the way the breasts are oriented. And one thing I never knew until I started learning about this is that there are actually 4 types of lobules.
And the lobules are the small,
the very small, yes, like the grapes. And there's 4 types of those based on the number of ductules that they have. Okay. So it's kind of, again, another way you could look at it is like how a vein or an artery branches out into capillaries. So the ductules are kind of like the little micro, branches. And so the different types of lobules depend on how many ductules they have. So just to give you an idea, type 1 lobules average about 11 ductules. Okay. Type 2 average 47. Type 3 average about 80. And a type 4 lobule, which is fully mature, has about that many, and it also contains colostrum or milk.
Okay.
And so a woman's breast is not fully mature until she actually has a complete pregnancy.
Okay.
And then further maturity actually takes place if she breastfeeds.
Okay.
So
So that's how the breast gets to full maturity, is by going through a full pregnancy and breastfeeding. Is there a specific amount of time that she needs to be breastfeeding, or is it just the breast actually just producing that milk?
I think by that point, yes, the production of the milk, and I do think there's, well, we'll get to it later, but there is added benefit, obviously, to the length of breastfeeding.
Okay.
But what happens then is that the breasts, pre-puberty are primarily composed of type 1 and 2 lobules. Okay. And the way that they are then matured is under the influence of, different hormones starting in puberty.
I have a question, and so even though pre-puberty, a young girl is already going to have type 1 and 2 lobules, is that the same for boys as well? And they just don't... Do you know?
That's a good question. I would have to say yes. I mean,
if it's pre-puberty,
right. That's a good question.
Okay,
we'll have to.
We can look it up later.
Because obviously, we know that males can develop breast cancer, so I would have to think that the anatomy's got to be fairly similar.
I didn't know males could have breast cancer.
Yes.
Okay.
I don't know the percentage breakdown, but it's actually it's surprisingly more than you would think.
I had no idea.
Yeah.
Okay. Okay.
Yes.
So, pre-puberty, type 1 and type 2.
Right.
Got it.
So then, under the influence of, primarily estrogen and progesterone, you start to see a shift. You actually start to see more of like a proliferation of those two types. So, whereas, you still have, mainly type 1 and type 2, but you're just getting more of those being created, And then when a woman becomes pregnant, there are basically 3 pregnancy hormones that are going to help make that shift from like a type 2 lobule to a type 3. They're human placental lactogen, human chorionic gonadotropin, which that's the HCG, that's the pregnancy hormone that we're using to detect pregnancy, and then prolactin. And so all of those are elevated during pregnancy, and so you start to see the type 2 lobules turning into type 3.
Okay. And that's only during pregnancy.
Only
that it
during
turns
pregnancy.
Into type
so
3.
Right. So none of that occurs. You have to have a pregnancy because some of those are actually produced in the woman's womb. Okay. So like during pregnancy. So you have to have the pregnancy.
Oh, you mean the hormones are produced in the woman's womb? Okay. Got it.
So, in the presence of the new life.
Yep.
So that's when that occurs. One other thing that I learned is that type 1 and 2 lobules actually have more hormone receptors. Okay. So it's almost like they're waiting, they're ready. They're waiting for, the move to mature onto type 3. Okay.
And then type 4 comes along after you have baby and you start to breastfeed.
Yes.
Okay. Yes. Gotcha.
And then it's thought that the lobules actually revert sort of back to type 3 after, but they still maintain their cancer resistance properties.
So talk about that for a second. Okay. So I remember you saying that certain types of lobules are actually cancer resistant. So go into that.
Yeah. So basically, we just know that type 1 and type 2 are much more prone to developing cancerous cells. And type 3 and 4 are not. Okay.
So they're more cancer resistant.
Yes.
So so this is basically saying if a woman is able to get pregnant and then breastfeed from that in and of itself can be a cancer prevention or breast cancer prevention. Yes. Yeah. Okay. So women that are not that do not get pregnant, or up until they get pregnant, they are more susceptible to get breast
so we
cancer.
Talk about like the susceptibility window, and they say that from the time of puberty until the completion of a full-term pregnancy, that is you're at the greatest risk of developing breast cancer.
Mm-hmm.
And the reason, again, is because you have the proliferation of type 1 and type 2 lobules. And we know that when you have cell mitosis, happening rapidly, it's just a numbers game, right? You're just more likely to have those potential mutations.
Okay. So then let's go into, I know your talk is mostly about the pill and about abortion and how those are linked to breast cancer. So let's focus on the pill first. And when I say the pill, I really mean just like any type of hormonal contraception, right?
Right.
So can you kind of go into describing how a woman who's on the pill is more susceptible to having breast cancer?
Sure. So, as we know, there's so many different types of hormonal contraception and different amounts of estrogen, progesterone, all of that. But basically, all of those are going to elevate a woman's estrogen and progesterone levels. And in doing that, you are basically, increasing the proliferation of those type 1 and type 2 lobules. So not only, and so this is where the risk to women and girls that have not had a full-term pregnancy becomes greater because you have immature breast tissue. And then on top of that, you are accelerating the proliferation of those type 1 and type 2 because you are adding additional hormones to the woman's body.
So with introducing hormonal contraception, you are introducing, even with those being synthetic hormones, you're still introducing more, which means there's more maturation, more cells, or
more proliferation. So you're like actually creating more type 1 and type 2 lobules.
Got it. Okay. With the pill.
With the pill, yeah.
And so that can be cause for possible more mutations on top of that.
Right.
Then. Okay.
Right.
Okay.
Yeah. So, so this connection is really more pronounced for women who have not had a pregnancy before. Okay. I don't know the numbers, for someone that has gone through a full-term pregnancy and then uses the pill, after that. That's a different situation, but this is, specifically for women who have not had a full-term pregnancy and whose breast tissue is not fully mature.
Okay. And so this is the information probably that your dad was seeing and was like, we need to teach other people about this.
Yeah, and also the fact that the pill is being prescribed for so many different reasons and at such an early age. Right. And that's the exact time that it's the most harmful, potentially harmful. Yeah. So
are we seeing an increase in
this was one thing that really, and this I kind of I took my dad's numbers and I had to sort of get updated stats. And then there was something that was really intriguing to me. So basically, just to get an idea, I looked up even today the estimates from the American Cancer Society for 2025. So these are estimates, but I compared them to 2024 numbers and they're almost identical. Okay. But they're estimating there will be 316,000, over almost 317,000 new cases of breast cancer in the U.S. So this is just the U.S.
Okay. In the year.
In this year.
Okay.
And that we will see about 42,000 deaths related to breast cancer. Now, the thing that was interesting to me, and I don't have all these numbers, but in my dad's initial presentation, he started giving stats, I believe, in about 2005. So I kind of just did a 10-year. And it's increasing. Okay. So the number of cases is still increasing. Good news is that the number of deaths is either stabilizing or getting a little bit less, and I think that we have better treatments. Right. We're identifying it earlier, so that's good news. But that's still a pretty big number. Yeah. And the thing that I wanted to know though is, so it's continued to climb, but the pill was introduced in, I don't even know, late 60s, early 70s. So I wanted to know, okay, what did breast cancer rates look like before the pill? And if you look, there is a study, International Association for the Research in Cancer, and it shows it was a chart that I found, and it's really fascinating because between about the years of like 1985 to 1988, there's like this jump. And it makes sense because now you're looking at about 25 years, 25 years of pill use.
Yeah.
So there's that latent period where, I mean, obviously, if you're taking the pill and all of this is happening, you're not going to get breast cancer like 2 years later, right? You're going to get it 20 years later, just because that's usually how the body works. Sure. Tumors are usually, slower growing. But so I thought it was really interesting because it was kind of like, there were these numbers, and then you see this big jump in the 80s, and then a sort of slower increase. Okay. But it's like, how does anyone explain why all of a sudden?
Did you see any supposable explanations of it, or nobody has an idea?
It's very hard. That is the other thing I've learned, because I did read Chris Kahlenborn's book, and it's hard to read because it's basically just going through research, and research is so complicated because it depends on who's the population of women that they're studying, what are their ages, what were they exposed to, there's so many variables. And then when you have people doing research that want certain outcomes, it's interesting. It's kind of easy to tilt it to that. Easy. So, so I thought this book is really good in that, he draws from so many different studies that you almost can't lie, right? Or like he obviously is looking for answers, and it's not just like an isolated study. So anyways, but
that is really interesting though about the 80s.
Yeah.
And jumping, because that is 20, 25 years later.
Yeah. And that's when you would start seeing the effects.
Okay. So for women who, let's say for a woman who has taken the pill as an adolescent and then ends up getting breast cancer because of the pill, are you saying it usually is about 20, 25 years that breast cancer will actually show?
Probably. Okay. I think it's, again, I mean, there's so many
variables.
So like her lifestyle, her, genes. I mean, that's huge. We know that. I mean, we know the genetic link is huge.
But it's not like she's going to get she's going to see breast cancer 2 years.
No.
After. Okay.
No.
Okay.
No. For sure.
It's going to show up later.
So it's going to take time. Yeah.
Okay.
So again, that's the other thing that makes research so difficult is, someone presents themselves with breast cancer and you're having to work backwards. Okay, well, when did you start this? What other... It's just, it's difficult.
Yeah.
It's difficult.
Yeah.
But I think when you start to understand, the nature of breast tissue, and then just talking about how breast cancer starts. Right. And if we know that it's, the proliferation of, and if we know that it's like during that time when, you have the proliferation of type 1 and 2 lobules, I mean, it makes sense.
So my next question is, does it matter how long a woman was on the pill? Would that affect
Yes, it does. And I don't have those. I do believe that it does.
Okay. Okay.
It depends on the length of time prior to that first pregnancy. Yes. Okay. Another thing that we didn't really point out is people want to know, okay, well, you're saying it can increase your chances, but how much? And I don't. So Chris Kahlenborn, he ended up publishing in the Mayo Journal in 2004, and after kind of all of his accumulated data, he came up with a number of about a 44% increase.
Wow.
Yeah. And then there was another study that was posted in the American Journal of Epidemiology in 2009, stating up to like a 60% increase. Wow.
So for a woman who was on the pill
prior to
her first pregnancy, has a 44 to 60-ish percent chance, or more percent chance of getting breast cancer. Wow. Yeah. That's insane.
I mean, so it's not negligible.
Is this known? Like if you were to go on like, what is it, the World Health Organization website or cancer websites or whatever, like, do they say, because I know you could find like the pill being a class 1 carcinogen for, is it breast cancer or is it a different type of cancer that I'm thinking of?
No, it's, I mean,
is it listed?
They declare
as,
it, yes.
Okay.
The World Health Organization does declare it as a type 1 carcinogen.
Okay, so it is known and admitted
Yes.
that it does cause cancer.
But again, if you try to just Google, is there a connection? Most of the time, what you're going to read right offhand is no.
Yeah.
Or that it's so minimal.
Yeah.
And again, it's like if they take certain pools of people, they can manipulate data to appear that it doesn't. But
but they'll also be the first to say that it helps prevent ovarian cancer.
Right. I mean, and you think about, breast cancer is so prevalent. Everybody knows somebody that's had breast cancer. And but how often do we find out, what is the history of that woman? Were they on the pill? Like, there's just not,
There's not, that data isn't collected very well. Yeah.
So.
In detail. Yeah. Well, so, okay, we've talked about the pill. Can you then kind of break down the idea of abortion being also a cause of breast cancer?
So those, you've got... in early pregnancy, you also, have that proliferation of breast tissue. And so as that's happening, especially, like in the early part, you're still waiting on those extra hormones that start moving it from type 2 to type 3. Okay. But you have proliferation of breast cells. And so if a woman is pregnant and she starts that process, but then abruptly ends it through an abortion, she's kind of like started the proliferation process and increased her risk for breast cancer, right? But then just cut it off. And so just as a woman who's using the pill is exposed to extra hormones and is also having that increased breast tissue, same with the woman in the early part of pregnancy.
Is a woman who is in, like, let's say first trimester, just naturally, is she also more susceptible to breast cancer just because?
Okay. Yes. So people ask me, well, what about miscarriage? So, so the answer is yes and no. Okay. So yes, in the fact that, again, she's starting her pregnancy, she's having the proliferation of breast cells, but oftentimes with a miscarriage, there's already probably something off hormonally. Okay. And so the normal pregnancy isn't happening, or
those hormones are already kind of slowing down.
Right. And so it's thought that while there could be an increased risk, it's not as stark as, having an abortion after.
Because with an abortion, you're saying that, okay, if you go through, you start a pregnancy and then let's just say, for example, you have an abortion at 11 weeks. Right. So those hormones, as long as the pregnancy was healthy, those hormones are naturally increasing as they should, but then the abortion is putting an actual abrupt stop to those hormones. Right. Whereas with a miscarriage, they're already kind of naturally coming down.
Right. Most likely.
If it's a hormonal issue.
Right. Okay. Which I think most miscarriages probably are to some degree.
You said that in pregnancy, it's the type 3 lobules that are beginning to grow. So at the beginning of pregnancy, are those type 3 lobules there yet? Or is it mostly just the 1 and 2 that are proliferating?
Think of it as the lobules are all there. What's happening is they're, if you remember, the reason we differentiate them by different types is the number of ductules. Right. So it's kind of like, how far out are they growing? Okay. And so what is the number of ductules? So the maturation is actually the increase of those,
Okay. So it's the increase of, like you were saying, think of like a artery with veins and then capillaries. It's an increase of like the very end
Right.
Capillaries
like the
almost.
smaller
Okay,
they get out,
okay,
like,
okay,
right?
okay.
The smaller they branch off, you know.
Gotcha.
The smaller, obviously, the smaller you go, the more you're increasing in number, right?
Right.
Like as you branch off, you're increasing the number of those. And so that's what's happening during the maturation.
Okay. So then you briefly mentioned this earlier, and I remember it from your talk a year ago, that the type 4 lobules, so you have those when you are nursing. Okay. Nursing doesn't last forever. So when a woman stops nursing, you said that am I correct in saying that she still has that cancer resistant cells? Okay.
So the way, I don't know if they know exactly, how it happens, but, and maybe the reason, you're going, type 4 are specifically characterized by having colostrum or milk.
Right.
So if you're not breastfeeding, then colostrum and milk are not present anymore. So I'm guessing that's why they consider it as reverting to a type 3.
Right.
But they still maintain that cancer resistance.
Okay. Interesting. So after a woman is pregnant, and whether she breastfeeds or not, she has those type 3 lobules. Do those ever go away?
No, I think, right. I think that's,
Okay.
kind of what's maintained.
Okay. But the reason but full maturation of the breast does include breastfeeding, at least for a time.
Right, yes.
To get to those type 4 lobules. Right. And then those do maybe not go away, but they stop producing milk and colostrum after some time, right? And so then, gotcha.
Yeah.
So she would still have then that cancer resistant.
Right.
properties.
And then I think it even, with each successive pregnancy, decreases her chance for breast cancer even more. Yeah.
Okay.
So
how often do you think, with how difficult this information is to find, do you think that doctors are actually trying to, so I hate to say hiding this from us, because I love doctors. They're much smarter than I am with they know so much more than I do.
I think everybody wants the easy fix. But I think that for doctors, yes, if I can just give you a pill and you're going to feel better in this regard, then that's what they do,
I think that goes for so many things too.
Yeah.
Painful periods, also irregular periods. I have my whole story too of just PCOS not being detected because of the pill. There's just so many things that are being pushed to the side because the pill is so easy.
What we don't think about too is that every cell in our body has hormone receptors. And so even though we're giving this pill to do a certain thing, it affects literally every cell in our body. And so
because it's not targeted
your body can't the pill can't be no, I'm not going to connect to you,
cervix,
they can't do that. So I think now we're realizing like you said, it literally affects everything from your immune system to your like you said, choosing your mate, who you're attracted to, and
that's a whole thing too.
I know. So so it's a lot, but I do think this is pretty. I don't know how this is getting so overlooked. I do think here and there you start to hear even when I was looking up, it's you'll find a news story here and there, or they do a little clip oh, there might be a connection, but it's I think people, sometimes they're well, I'm just going to take that risk because I don't know what else to do. Right. I don't know how else to prevent a pregnancy right now because it's not timely for me, So that's the unfortunate thing. So I think it's just education.
Yeah, absolutely. Well, I think that goes for a lot of medications too. I'm thinking of those commercials that for random medications. And they list you can have
diarrhea, suicidal thoughts. And you're
and it's this lady that's frolicking through everything is saying explosive diarrhea.
Right, I know. And you're well, I don't know, is the original
or
problem as bad?
Yes. But I think it's common for us to think, oh, okay, well, that's not going to happen to me because that's worst case scenario. Right. But I think, going back to that stat that you gave of 44% increase, at least increased chance of getting breast cancer with the pill.
And that's just one factor. If you, part of the presentation I gave kind of brings in all of the other factors that, can come into play with breast cancer. And it's okay, if you're already starting at a 44% increase,
Yeah.
And then tack on, genetics and environment and
right.
whatever, alcohol, obesity, any of those things, and it's like, now you're knocking it up higher.
Well, and breast cancer also is very genetic, right?
Yeah, it is.
So some women are more susceptible already just based on their genetics.
Right.
They're more apt to get breast cancer than others. But the pill isn't helping any.
Right.
Again, like I said in the beginning, it's a lot of information, but it's easy to follow. Like with understanding, okay, the 4 types of lobules that your body could possibly have during your lifetime. Do we have, thinking too about the abortion rates, do we have any stats on that? Like how much increase we've seen of breast cancer for women that have had an abortion?
There's gotta be. And I think that when I read through this book, I was definitely honed in a little bit more on the pill. But it would be good to probably go back because I'm sure he has...
Can you tell the name of the book again?
So it's Breast Cancer. It's linked to abortion and the birth control pill.
Okay.
And it's Chris Kahlenborn, MD.
Okay. And it's not his data.
It's not his data. He literally just he just collected all the study, a whole bunch of studies over, the course of several, even probably decades.
Yeah.
And then he also, it goes in, I don't know a lot of research terminology, but there's just so much that goes into, what makes up a given case study. And if he kind of makes it at least palatable for everyday man. But after a while, it was a little bit cumbersome.
Yeah. Which is why your dad made a PowerPoint
presentation.
I
was like, yes. I'm like, hey, cut to the end. What's the
yes?
But I think it's like even more convincing though because it's not just his own research, right? Like he's taking the good and the bad or whatever. He's and then he kind of would through each case explain why is this a strong research study? Why is this one weak? Why are these results off from what the rest are? But it's really impressive, and I know that he has presented this information internationally too, and I don't it's like. But it's not really what people want to hear because people love contraception. Yeah. And I just feel like all of these, I just remember when I was prescribed the pill at 16 years old, like none of this was told. And even though I understand you have a 15-minute appointment with your doctor, they can't go into every single thing of every single detail, even if it is a good medicine, whatever they're giving you. But with how much or how many ramifications this pill actually has and is not told, and you have to listen to a podcast to know to know what it's doing to your body, like that. There's something there for sure. Well, this was incredible. Thank you so much for having me,
ironing this out and just making this information accessible, I think. And thank you to your dad for being the start of this information getting out and more widely known.
I know. So. Thankful. And I think we're living in a I'd say like a better time as far as I think people are starting to want to know these things. And
I was talking to Armida, who's the NFP coordinator in Phoenix, and she was telling me, she's been teaching for decades, NFP, for teaching for decades, and she told me just in the last 10 years, she's noticed a shift of women recognize, maybe not wanting, not with the idea of morally with contraception, because that's a whole other thing too, but just what the pill is actually doing to our bodies. I think we're actually starting to become more aware and more familiar with that. And what is a better option? Because as women get more crunchy, which is what we're kind of starting to turn into, right? Which is great. It's great because when we can get down to the idea to what is this medicine actually doing to my body? How is it actually causing me to increase my risk of breast cancer? Those are big things. It's a big deal. It's a life or death scenario. Well, thank you so much for being on. I really appreciate you taking the time.
Yep. Thank you.
Thank you for listening to the Truth and Fertility podcast. If you are enjoying this content, it would be amazing if you could leave a 5-star review. That helps me tremendously to be able to continue to produce these episodes for you. Remember that these podcasts are available on Apple, Spotify, and Amazon and YouTube. And you can always go to my website, truthandfertility.com, to learn more. Thanks again for listening, and I'll talk to you again next week.